everyone, I am Dr. Gayathri BN, Consultant Gynecologist from Rainbow Hospital, Panerghatta Road. Today I want to discuss few points which will help a young couple to decide about the timing of their pregnancy. In older generation, this was not even a question because usually girls used to get married at younger age and they used to plan their pregnancy within 1 or 2 years of their married life. But now women are becoming more and more career oriented. So, timing of pregnancy is an important question. When a couple comes to us and asks what is the right age to conceive, we tell them there is no cutoff age, but it's always better to conceive before the age of 30 because of its own reasons. 1. Genetic problems in the baby is increased as the mother age increases, like Down syndrome and other genetic problems increases with increasing mother age. Second, the chance of miscarriage is increased with increasing age. And the third reason is medical conditions like increased BP, gestational diabetes and other medical problems during pregnancy is increased if mother is of older age. Because of all these reasons, it's always better to plan pregnancy as early as possible. But for a valid reason, if a couple wants to postpone the pregnancy, like she's in a very important milestone in her career, or because of financial reasons, or husband-wife relationship needs some more time to settle, then there is meaning in postponing the pregnancy. What are the points to consider when they want to delay pregnancy? The main issue is egg reserve. What is it? A girl is born with fixed number of eggs. As she ages, she will be losing certain number of eggs every month. Even though one egg matures and ovulates in a month, there are many other eggs which perish during this process. So as aging increases, especially after the age of 35, the number of eggs remaining in ovary are very less. And there is no medication or there is no procedure which can increase this number of eggs. So once the eggs are lost, it is permanent. Certain chronic diseases like tuberculosis, chemoradiation for cancer treatment, certain genetic disorders and also bad lifestyle can increase the egg loss at a faster rate. So we can tell that having a good lifestyle, eating healthy diet, avoiding exposure to pollution and strong chemicals, eating preservative food, if you avoid, you can decrease the rate at which eggs are losing. So to have a good ovarian reserve, it's important to follow a very good lifestyle. Whenever you want to delay pregnancy, first thing you have to do is consult your doctor and discuss your concern. Your doctor may ask you to do certain blood tests and ultrasound scannings to find out your general health, because if we find out that certain medical conditions like thyroid, diabetes or increased BP or some fibroids in your ultrasound scan, we have enough time to treat them even before you actually plan your pregnancy. The doctor will tell 2 important tests to know your ovary reserve. One is a blood test called AMH blood test. AMH means anti-Mullerian hormone. It's a hormone produced from ovary to measure the egg reserve. It is usually done at any day in your menstrual cycle. Good AMH, increased value of AMH means you have good reserve, and decreased level of AMH means you have a very less egg reserve. The other important test is ultrasonography with AFC, that is antral follicular count. It is nothing but a count of baby eggs in earlier days of your menstrual cycle. After doing all these tests, if your egg reserve is found out to be good, we are at a relaxed pace. But this does not mean you can delay the pregnancy infinitely. Retests, reconsultations with your doctors at time intervals are very important to confirm that your fertility is maintaining. Suppose if your tests tell that you have very egg reserve, then 2 options are there. One is to plan pregnancy immediately, prioritizing it. The other option is to freeze the eggs. Discuss with your partner and take a combined decision in order to plan your pregnancy. Usually when a young couple comes to us, we ask them to try for 1 year, and then if not succeeded, we ask them to come back to us. But in a couple who are elder than 35 years, we always tell them to try for 6 months, and if there is no success, immediately they should report to doctor, because every month is very precious when you are delaying your pregnancy. Thank you.